Imagine, a young puppy bouncing around, maybe a bit stocky, but something seems a little off. Maybe their legs.
Or their face looks slightly different.
Yeah, exactly. Or picture a kitten full of energy, but, well, smaller than the others, maybe with a slight haze in their eyes.
Hmm,
Let's unpack that, because today we're doing a deep dive into something called mucopolysaccharidoses, MPS for short.
right. And MPS, it's basically a group of inherited conditions.
Inherited, okay.
And what's really fascinating is how they show us, how precisely the body usually handles really complex molecules.
How so?
Well, MPS is essentially a glitch, a problem in the body's recycling system, specifically for breaking down these complex sugars called glycosaminoglycans.
GAGs.
GAGs!
Right, I've heard that term.
Think of them like building blocks the body uses,
Yeah.
but then it needs to dismantle them afterward.
Like an MPS.
That dismantling process doesn't work right. It fails.
Okay, so these GAGs, they're not broken down. They just build up.
Exactly. Instead of being cleared away, they accumulate, like molecular trash piling up.
And what happens when that trash piles up?
Well, it builds up in different tissues,
Right.
organs, and that leads to a whole range of problems. It's kind of a domino effect, really.
Okay, so this deep dive, it's for you if you're curious about these conditions, specifically in dogs and cats, why they happen, what it all means. And our guide for this is the paper Veterinary Mucopolysaccharidoses in Dogs and Cats. Our mission, really, is to pull out the key info on MPS in pets.
Explaining the different the signs you might see.
Right, and the science behind it all.
And, understanding MPS in animals, it isn't just about helping pets, though that's crucial. It also helps us understand these same conditions in humans, too.
That's a great point. Okay, so let's get into the basics then. What are the first clues? What might make a vet think, could this be MPS?
Well, you'd start considering MPS if you see a young animal with, say, stunted growth. They're just not growing right. And they have skeletal issues, bone problems that seem to get worse over time. That progressive nature is key.
Getting worse. Right.
And then there's something you see under the microscope. Specific white blood cells, neutrophils and lymphocytes, they contain these unusual little bits, inclusions.
Inclusions in the blood cells.
Yeah, those are sort of the early warning signs that something's up with their metabolism.
Got it. Early warnings. And it all links back to that problem breaking down GAGs. What's the root cause of that failure?
The fundamental issue is a defect in one of 11 specific enzymes.
11 enzymes. Okay.
Yeah, think of these enzymes as like highly specialized tools the body uses to break down the GAGs piece by piece. If one tool is faulty or just missing,
The job doesn't get done.
exactly, the GAGs can't be processed. And what's really quite remarkable is that almost all of these enzyme defects seen in humans, they've also been found in animals.
Wow, that's incredible. Such a parallel. So where do these undigested GAGs actually pile up and cause trouble?
They accumulate inside cells within these little compartments called lysosomes.
Lysosomes. I remember those from biology. The cell's recycling centers.
Precisely.
Yeah.
Yeah. When that breakdown process is blocked, the lysosomes get overloaded with GAGs. Imagine the recycling bin just overflowing and never getting emptied.
Okay. Bad news for the cell.
Definitely. And this progressive overload leads to problems in lots of places. The skeleton, obviously. The eyes, the heart and blood vessels, the liver.
A lot of systems affected.
Yes. Though interestingly, in humans, MPS often causes significant central nervous system problems. But in animals, those CNS issues usually aren't as clinically apparent.
That is interesting. Okay, so buildup of sugars, missing enzyme. Now, the source mentioned different types of MPS. Can you walk us through those?
Sure. There are several types recognized in dogs and cats. Each one is linked to a specific missing enzyme and, consequently, the storage of particular GAGs.
Okay.
We see MPSI, MPS2, MPSI, IIB, 6 and 7 reported.
Right, let's maybe take them one by one. What's the story with MPSI?
Okay, MPSI. That's caused by a deficiency in an enzyme called alpha-L-iduronidase.
Alpha-iduronidase, got it.
And when that enzyme isn't working, two types of GAGs pile up, dermatan sulfate and heparan sulfate. So that specific tool is missing for those two.
Okay, and MPS2?
MPS2 involves a different enzyme,
Yeah.
aduronate sulfatase. But interestingly, it leads to the storage of the same GAGs as MPSI, dermatan sulfate, and heparan sulfate.
Same GAGs, different enzyme.
Exactly. And a little bit of trivia, MPS2 was actually the very first type of MPS ever recognized in humans.
Oh, really? An early discovery. Okay, what about ICA and IB? They sound connected.
They are, in the sense that both involve the storage of heparan sulfate, just heparan sulfate this time.
Okay.
But the enzyme defect is different. In MPS-IA, it's heparin N sulfatase that's deficient. In MPS-IAB, it's alpha N acetylglucosaminidase.
Whoa, those are mouthfuls.
They are. But basically, different tools missing, same stuff piling up.
Got it. Heparin sulfate. Okay, next is MPS 6. Anything unique there?
MPS 6 is caused by a deficiency in aryl sulfatase B, and the main GAG stored here is dermatan sulfate.
Dermatan sulfate again?
Yes. And notably, MPS 5 holds the distinction of being the first type of MPS ever recognized in an animal.
Ah, okay. So MPS 2 was first in humans, MPS 6 first in animals. That's a cool piece of history for veterinary medicine.
It really is.
And finally, MPS 7.
MPS 7 happens because of a deficiency in beta-glucuronidase. And this one's a bit different because 3 types of GAGs accumulate: dermatan sulfate, heparin sulfate, and chondroitin sulfate.
So that enzyme handles a wider range of GAGs.
Seems that way, yes. Its absence causes a broader buildup.
Okay, so each type is like a specific missing piece in the body's sugar processing machine. Different missing pieces lead to different or sometimes overlapping buildups. Now, who gets these? Which animals are typically affected?
Yeah, there are definitely breed and species predispositions. Looking at cats first.
Okay.
MPSI and 7th have been reported in domestic shorthairs. Your typical Moggy. And MPS 6, that's been seen in Siamese cats and domestic shorthairs.
So domestic shorthairs seem to pop up a few times there.
They do. So if you have one showing some of those early signs we talked about, MPS might be on the vet's list of possibilities.
Good to know. And what about dogs? Which breeds should owners be aware of?
It's quite specific for some types in dogs. MPSI has been found in Plothounds.
Plothounds, okay.
MPS TOR is seen in Labrador Retrievers.
Labs, wow, popular breed.
Very. Then MPS-IIA that's been identified in wire-haired Dachshunds, Huntaway dogs from New Zealand, Rottweilers, and Boston Terriers.
Quite a mix there.
It is. MPS-IID affects Schipperkees.
Schipperkees, right.
MPS-X is turned up in miniature Pinschers, miniature Schnauzers, Welsh Corgis, and even a Chesapeake Bay Retriever.
Min Pins, Schnauzers, Corgis, common breeds again?
Yes. And finally, MPS-Assect has been seen in mixed breeds and in German Shepherds.
Okay. That really does highlight the genetic angle with these specific breeds cropping up.
Absolutely.
The source also mentions something about sex predisposition for some types.
Yes, that's important. MPS 2 primarily affects males.
Males, mostly. Why is that?
It ties into its inheritance pattern. It's X-linked recessive. Because males only have one X chromosome, if they inherit the faulty gene on that X, they'll get the condition.
Ah, okay. Makes sense.
Whereas the other types we discussed, MPS I, 3, 6, and 7, they affect both males and females pretty much equally. They follow an autosomal recessive pattern.
Right. Autosomal recessive. Need 2 copies of the faulty gene for those.
Exactly. One from each parent.
Okay, so we've got the types, the breeds, sometimes the sex. But what does it actually look like? What signs would an owner or vet see in a young animal?
Well, the signs often start becoming noticeable between, say, 2 and 4 months old. And the tough part is they tend to get progressively worse.
Okay, what kind of signs?
Dwarfism is a common one. The animal was just unusually small. Although, interestingly, you don't usually see that in cats with MPSI.
Huh, okay. Exception there. What else?
You might notice smaller ears, eyes that look wider set than normal.
Wider set eyes, okay.
A flattened face, sometimes.
Yeah.
And maybe the tongue looks a bit large for their mouth.
And you mentioned bone issues being key earlier.
Yes, definitely. Significant bone disease is a hallmark. The technical term is dysostosis multiplex, basically. Widespread problems in how the bones develop.
Dysostosis multiplex.
Right. And this leads to things like degenerative joint disease, problems with joints wearing out too soon. Hip subluxation, where the hip joint isn't properly seated, can happen too.
That sounds painful.
It certainly can be. And you mentioned Siamese cats earlier. In them, the facial changes, the dysmorphia, can be quite striking because they normally have such an elongated face shape.
Right. The contrast would be more obvious. Are there internal signs owners might not see directly?
Yes. Liver enlargement, hepatomegaly, is common in most MPS types. The exception seems to be cats with MPS-CI. They don't typically have an enlarged liver.
Okay.
And then there's the eyes. Cloudiness of the cornea, the clear front part of the eye, that can start quite early, maybe around 8 weeks old.
What causes that cloudiness?
It's due to tiny granular deposits building up within the cornea itself. Those GAGs accumulating.
Ah, the GAGs again. Okay. And the large tongue we mentioned, what about the heart?
The heart valves can thicken, which isn't good for heart function long term.
Okay.
And because of all this GAG buildup, affected animals often spill excess GAGs into their urine. That's a diagnostic clue.
Excess GAGs in the urine.
Right. And another huge clue, back to the blood cells, is finding those specific granules, sometimes called Alder-Riley bodies, or metachromatic granules inside the leukocytes, the white blood cells.
Those inclusions you mentioned earlier.
Exactly. They're little visible indicators that something's not being processed right.
So a whole constellation of signs, really. Physical changes, internal changes, things in the blood and urine, and they all get worse.
That's the general picture, yes. Progressive difficulty moving around is pretty consistent, and some specific types have particular features.
Like what?
Well, in cats with MPS-ES, the skeletal problems tend to be even more severe than in cats with MPS-I.
More severe bone issues in MPS-CS cats?
Yes, and some of those cats can even develop weakness in their hind legs, posterior paresis, because the spinal cord gets compressed by abnormal bone growth.
Oh, wow. Spinal cord compression.
Yeah, and you might also notice the animal seems painful if you try to gently move their head or neck.
Okay. It really sounds like a systemic condition affecting multiple parts of the body. We touched on the genetics, autosomal recessive for most, X-linked for MPS2. Can we dig into that a bit more?
Right.
Why does this happen genetically?
Sure. So, for the autosomal recessive types, which is most of them,
MPS I, 3, 6, 7.
right, an animal has to inherit 2 copies of the faulty gene, one from its mother, one from its father, to actually have the disease.
2 copies needed. What if they only get 1?
If they get just 1 faulty copy and 1 normal copy, they're typically fine. They become a carrier. They don't show signs, but they can pass that faulty gene on to their offspring.
Okay, so carriers look normal.
Usually, yes. Now, for MPS2, the X-linked one.
The one mostly in males.
Correct. The faulty gene is on the X chromosome. Males only have 1 X chromosome, XY, so if they inherit that 1 faulty X from their mother, they will have the disease.
Because they don't have a second good X to compensate.
Exactly. Females have 2 X chromosomes, XX. So for a female to get MPS2, she'd generally need to inherit the faulty gene on both of her X chromosomes, one from each parent, which is much rarer. Females with 1 faulty X are usually just carriers, like in the autosomal recessive cases.
Okay, that clarifies the inheritance patterns. And how does breeding practice influence the risk here?
Well, given it's genetic, inbreeding is a major risk factor if that faulty gene happens to be present in a family line.
Why inbreeding specifically?
Because inbreeding means breeding closely related animals, parents to offspring, siblings, half-siblings. This significantly increases the chances that an animal will inherit 2 copies of the same gene from a common ancestor. And if that gene happens to be the faulty one for MPS...
Then you get affected puppies or kittens.
Precisely. It concentrates the risk.
Yeah.
It's a really critical point for responsible breeders.
Absolutely. Okay, so let's say a vet suspects MPS based on the signs and the breed, perhaps. How do they go about confirming it? What's the diagnostic process?
It's usually a step-by-step process. First, the vet needs to consider other things that could cause similar signs. We call this building a differential diagnosis list.
Right, ruling other things out. What else might look like MPS?
Well, thinking about those granules in the blood cells.
The metachromatic granules.
Yes. There's another group of lysosomal storage diseases, GM2 gangliosidosis, that can also cause similar granules. But usually, GM2 causes clear neurological signs and, sadly, early death, which helps tell them apart.
Neurological signs are less common in animal MPS, you said.
Generally less clinically significant, yes. Also, interestingly, some perfectly healthy Burmese cats can just have these granules in their neutrophils normally.
Oh, really? Just a breed thing?
Apparently so. And very rarely, severe inflammation or toxicity can cause something called toxic granulation in neutrophils, which might look a bit similar.
Okay. What about the cloudy eyes? That seems pretty distinct.
It is a strong sign, but other conditions can cause corneal clouding too. Several other lysosomal storage diseases like acid lipase deficiency, GM1 gangliosidosis, and mannosidosis can do it.
More storage diseases.
Exactly. So sometimes a panel of tests for different lysosomal enzymes is needed. Plus, things completely unrelated to storage diseases like corneal edema or dystrophy can also make the cornea look cloudy.
So cloudiness isn't automatically MPS, and the bone changes on X-rays.
While the pattern in MPS, that dysostosis multiplex, is often quite characteristic, a few other things might show some similar radiographic features. Congenital hypothyroidism, for instance, or certain types of epiphyseal dysplasia, which is another bone development disorder, even sometimes getting way too much vitamin A.
Hypervitaminosis A, right. Okay, so it's complex. What about routine lab tests, like blood work and urine tests? Do they help?
They definitely provide important clues. A complete blood count, The CBC and check-in blood chemistry are standard.
And a urinalysis.
And that's where they might see the granules. Yes. Examining a blood smear, usually with a special stain, is key. That's where you look for those metachromatic granules in the neutrophils and monocytes. Although they can be harder to spot in MPSI, and they often don't show up well with the standard quick stain vets use called DiffQuick.
Need special stain sometimes.
Often, yes.
Yeah.
And sometimes you might also see tiny vacuoles, little clear bubbles that contain these granules inside the lymphocytes too.
Okay. Can they look for these granules elsewhere?
They can. If samples are taken, say, from lymph nodes or the liver or bone marrow, or even fluid drawn from a joint. Specially prepared slides for those can also show cells containing these granules.
Lots of places to look.
And the urine test is very important too. Finding excessive amounts of GAGs is a big red flag for MPS. There are simple screening tests like the berry spot test, which gives a qualitative idea.
The spot test, okay.
And then there are more precise lab tests that actually measure the quantity of GAGs being excreted.
But how do they nail down the specific type of MPS, get that definitive diagnosis?
Right, the gold standard, the definitive diagnosis, comes from measuring the activity of the specific lysosomal enzyme that's suspected to be deficient.
Measuring the enzyme's activity level.
Exactly. You see if that specific tool is working or not. This is usually done on a blood sample, looking at the white blood cells, or sometimes using a liver tissue sample obtained via biopsy.
A liver biopsy sounds quite involved.
It can be. But the good news is, for most MPS disorders in dogs and cats now, there's DNA testing available.
Ah, genetic testing.
Yes. Using either a blood sample or often just a simple cheek swab, labs can look for the specific gene mutation known to cause that type of MPS in that breed.
That sounds much easier and less invasive.
It often is, yes. It gives genetic confirmation.
And what about imaging, like X-rays? What do they typically show?
Radiographs, or X-rays, can reveal quite a few characteristic signs. You often see bones that look less dense overall, maybe with thinner outer layers, the cortices.
That's bone density.
Right, and abnormalities where the bones grow at the ends, the epiphyses. These can range from just slight irregularities to quite severe, sort of scalloped out defects in the bone, right under the joint cartilage.
Scallop defects, okay.
You also often see joint changes like flattened hip sockets, the acetabula, and extra bony growths, spurs, forming around the joints.
Signs of that degenerative joint disease.
Exactly.
Yeah.
And there's a really unique finding, sometimes seen in cats, with MPF extra bone grows around the little joints in the spine, the vertebrae. It can sometimes even cause bones in the neck, the cervical vertebrae, to fuse together.
Neck bones fusing, wow.
Yeah, it's quite specific when you see it.
So it's really a combination approach. The clinical signs, the breed, routine labs, maybe urine tests, imaging, all leading towards either specific enzyme testing or DNA testing for that final confirmation.
That's generally how it works, yes. Putting all the pieces together. Okay.
So once that diagnosis is confirmed, what can actually be done? What are the treatment options?
Yeah, this is often the most challenging part. When you talk about treatments that actually fix the underlying problem, the missing enzyme, the options exist, but they come with pretty big hurdles, especially for pets living in a normal home setting.
Okay, hurdles like what?
Well, one approach is bone marrow transplantation, or BMT.
Bone marrow transplant, how does that help?
If it's done very, very early in life, ideally before the skeletal changes are severe, and if the transplant takes successfully, the healthy donor cells set up shop in the recipient and start producing the missing enzyme.
So the new cells provide the enzyme.
Right. And that enzyme can then get distributed to various tissues. In some cases, this has allowed affected animals to live much more normal lives.
That sounds promising. But what are the catches?
Several big ones. BMT is much less effective if it's done after the animal skeleton has already matured. It's also incredibly expensive.
Right.
And it carries significant risks, like rejection or graft versus host disease. Plus, you need a perfectly matched donor, usually a healthy littermate sibling, which isn't always available.
Okay, so complex, costly, risky, needs a donor. Sounds tough for most pet owners.
It generally is, yeah. More common in research settings.
But what about enzyme replacement therapy? ERT, I know that's used for some human conditions.
Yes, ERT is another approach. This involves giving the animal regular infusions of the missing enzyme, which has been manufactured using recombinant DNA technology.
So giving them the enzyme they lack, does it work?
It has shown positive results in animal models of MPS, yes. It can reduce GAG storage and improve some clinical signs.
There's always a but, isn't there?
There often is. A major limitation is distribution. The enzyme given intravenously often doesn't cross the blood-brain barrier effectively, so it doesn't reach the brain well.
Okay, so limited help if there are CNS effects.
Exactly. And in some types of MPS, it also doesn't penetrate well into the joints or cartilage, which are major problem areas.
Right, other downsides.
Cost is, again, a huge factor. And the animal's immune system can potentially develop antibodies against the replacement enzyme, making it less effective or causing reactions. And perhaps the biggest practical issue is that EARD requires frequent, often weekly or biweekly intravenous infusions for the entire life of the animal.
Lifelong, frequent IV infusions. Wow, that's a massive commitment.
It absolutely is. So, like BMT, ERT is not commonly used for client-owned pets currently, mainly due to cost and logistics.
Okay, so BMT and ERT have major practical challenges. What about gene therapy? That always sounds like the future.
Gene therapy is definitely a really exciting and active area of research for MPS, and it has shown significant promise, even cures in some animal models.
How does it work, basically?
The core idea is to introduce a normal, working copy of the faulty gene into some of the animal's own cells. You essentially genetically engineer some of their cells to fix the problem.
So their own cells start making the missing enzyme.
That's the goal, yes. The hope is that these corrected cells will then produce normal enzyme and release it, allowing other deficient cells nearby, or even distant ones, to take it up and function better.
That sounds incredibly sophisticated. What are the main roadblocks there?
Still several key challenges. One is delivery, getting the therapeutic gene efficiently into the right target cells, especially hard to reach places like the brain, if needed.
Getting it where it needs to go.
Right. Another is achieving long-lasting expression. You want the corrected cells to keep producing the enzyme for years, ideally lifelong, from a single treatment. That's technically difficult.
Ensuring it keeps working.
Yes. And finally, researchers are working on ways to control the level of enzyme produced. You don't want too much or too little. It needs to be regulated properly.
Okay. So these definitive treatments, BMT, ERT, gene therapy, while holding potential, seem mostly experimental or research-focused for animals right now.
That's a fair assessment, yes. They often parallel the developments in human MPS research. But practical application in veterinary medicine is still limited, mainly by cost and complexity.
So in the meantime, are there any more sort of basic supportive things that can be done for affected pets?
Absolutely. While we might not have readily available cures that fix the enzyme defect in most cases, supportive care is really important for managing symptoms and maintaining quality of life.
Like what kind of supportive care?
Well, for example, these animals are often more susceptible to respiratory infections. So prompt diagnosis and treatment with antibiotics if they get pneumonia or bronchitis is crucial.
Okay, managing infections.
And pain management becomes very important as the skeletal and joint disease progresses. Using appropriate pain relief medications can make a big difference to their comfort and mobility.
Keeping them comfortable makes sense. So thinking long-term then, what's the follow-up and what's the overall prognosis?
Well, starting with prevention, that's key. In breeds or families where MPS is known to occur, avoiding inbreeding is paramount.
Don't breed affected animals or carriers, basically.
Exactly. And testing potential breeding animals is crucial. We mentioned the DNA tests, and enzyme activity tests can also identify carriers, those animals with one faulty gene copy who appear healthy but could pass it on.
Carrier testing is vital.
Very. Now, as for the expected course and prognosis for an affected animal, it's generally considered better if they receive one of those definitive treatments, like BMT or maybe gene therapy, successfully at a very young age.
Right. Early treatment helps.
But again, we have to stress, those treatments are usually very expensive, potentially risky, and often only available through research programs. They're not standard options yet.
Okay. So for the majority of affected pets that don't get those treatments.
For untreated animals, the outlook is unfortunately quite poor long-term. They will almost certainly develop severe, progressive skeletal and joint problems.
Making it hard for them to move.
Yes. Sadly, many may become immobile or have such poor quality of life due to pain and disability that euthanasia is considered by the time they're maybe 3 to 5 years old.
That's really tough. So it's a really complex group of conditions, isn't it, with a huge impact.
It really is.
Okay, so to try and wrap up our deep dive, it sounds like MPS in dogs and cats boils down to a fundamental problem with processing certain body sugars, the GAGs.
Right, a breakdown in the breakdown process.
Which leads to this buildup, this storage, causing a whole cascade of physical issues bones, joints, eyes, liver.
Exactly. Problems that tend to show up early and sadly worsen over time.
And early diagnosis, while maybe not leading to a readily available cure right now, is still super important.
Absolutely vital for managing the individual animal as best as possible and critically for making informed breeding decisions to prevent it in the future.
And that ongoing research, especially into things like gene therapy, that does offer real hope down the line.
It certainly does. Science is constantly moving forward.
Okay. Well, on that note, here's maybe a final thought for you, the listener, to mull over. We've talked a lot about the clear genetic basis of MPS and how diagnostic testing, especially DNA testing, is becoming more available.
So what ethical considerations does that raise? When we think about breeding practices, access to testing for breeders and owners, how do we balance wanting to preserve certain breed characteristics with the responsibility to actively prevent serious inherited diseases like these?
It's a really important question. That balance between breed standards and health.
Definitely something to think about. Thanks so much for joining us on this deep dive today.